So Vivek, thank you for being with us. This is truly wonderful. It's a great honor for us. You know, a lot of people don't know who you are or that the fact that you were Surgeon General.
Yeah.
So tell us a little bit what is to be the Surgeon General, and tell me what that position entails.
Well, Carlos, it's great to be with you today, and hello to everyone who's out there and watching. I did have the great privilege of serving as Surgeon General between 2014 and 17. And what the role of Surgeon General entails is largely two big things. One is to make sure that you're providing the public with the best scientific-based information on health, so people can make good decisions for themselves and for their families. And that's true during pandemics and outbreaks and emergencies, but also it's true even in between to make sure people understand how to prevent chronic disease and manage mental health challenges. The second role of the Surgeon General is to oversee the United States Public Health Service Commission Corps, which is one of the uniformed services in the US government, and a group of 6,500 plus officers, including doctors, nurses, physical therapists, pharmacists, and other medical health professionals. And in their day jobs, they help to advance public health in their roles at the CDC, the FDA, NIH, and many other federal institutions. But during times of emergency, we also deploy them and to help assist and shore up medical and public health capacity. So during the Ebola outbreak, we sent hundreds of officers to West Africa to set up what was called the Monrovia Medical Unit to provide medical care to people with Ebola. During 9/11, after hurricanes and tornadoes, we deploy our officers to help shore up capacity there. So that's the response. Those are the responsibilities of the Surgeon General.
So, you know, I remember my first encounter with the role of Surgeon General was during the AIDS epidemic when C. Everett Koop sent all of us to our houses this pamphlet about HIV that I wish I still have, because it was really, would have been a classic by now. I should have never thrown it away. But then, you know, there's been important reports around smoking, many things that Surgeon General has done. So what do you see, if you were the Surgeon General right now during a pandemic, what do you think you would be doing? What would you like to do? If in an ideal condition, what do you think the Surgeon General should be doing?
Well, in this moment, Carlos, there are three big areas I would be focused on. So one would be to making sure that I was communicating directly with the public about the facts and the data and around measures to protect yourself as it concerns COVID-19. And because this is a rapidly evolving area, because we're learning more and more about this virus every day, it's important that that communication is clear, consistent, and ongoing. And so that would be one of my functions. The other thing that I would do is I would work closely with the Commission Corps itself that I oversaw to understand how we could deploy them in the most efficient and judicious way possible to help expand testing, to expand clinical care where it was needed, where the virus was surging. And I would also actually look to see how we could deploy our Commission Corps to advance public education, recognizing how much misinformation is out there. But finally, there's an important role that the Surgeon General plays as a partner in the administration with the White House, with the Secretary of HHS, with the heads of the CDC, NIH, FDA, and with other leaders throughout the administration to help develop the right strategy to address that pandemic. When I was Surgeon General, we dealt with Zika and Ebola, and those were efforts where we were also learning a lot as we were seeking to respond in parallel and working in close collaboration, bringing the voices and perspectives of frontline healthcare workers as well as people in the general community was a role that I played then as Surgeon General that I think is even more important now.
Well, you know, so now you're no longer the Surgeon General, but you and I have been involved in a lot of things, you know, whether it's with the NCAA or other organizations. So we learn a lot about this pandemic. We're still learning. Where do you see the pandemic to do today, and what are your predictions? I mean, is this going to be with us forever? What do we as frontline clinicians need to be doing?
Well, gosh, that's such a great question, Carlos. And I really wish I had a crystal ball to be able to tell us where we would be in a year, in 2 years, in 3 years. And the simple answer is that it's very hard to forecast where this virus is going. But there are some things we do know. We do know how it's transmitted and how we can protect ourselves. And so many of the measures that we have been talking about, especially in recent weeks, around the use of masks, around hand hygiene, around distancing and avoiding indoor spaces that are poorly ventilated, these will continue to be incredibly important when it comes to reducing caseloads. But unfortunately, what we've seen is that much of this information has become politicized, and wearing masks, for example, has become a political statement. And that's very unfortunate because we need that to be put back in the context of public health. And the role of doing that, I think, falls squarely in the lane of nurses and doctors and other healthcare workers who not only are on their front line, but also have a great degree of public trust. So I think depending on how good we are at changing behavior to reduce risk in the community, depending on how we are as a government at ensuring we are investing and expanding capacity to test and to contact trace, which are essential, but where we're still lacking, these will really determine where we go. I will be honest, I thought in March, when everything started to shut down, that we would do what we needed to do in terms of staying home and then in terms of using that time to build up testing and tracing capacity to be able to be in a place where we could potentially open up schools and where we can start to get back to our lives by the end of the summer or the fall. But clearly that's not the case. We've seen a resurgence of the virus and we're still not where we need to be. So a lot of this story is yet to be written, but as much as we are still learning, there are levers that are under our control that we still have yet to pull and pull effectively as individuals and really as a government. And I'm hoping that in the coming months, we can do what we need to do and in terms of tamping down the overall rate of infection and in terms of getting testing and contact tracing measures in place so that we can keep surges of infection small. And if we do that, I think that there's a chance we could start to resume some activity. But I don't think that we're going to be in a place where we have normal activity in the United States anytime this year. I don't think we will have a vaccine until next year. So these changes that we see will likely be with us for some time.
Well, it's a very sobering but realistic view, and the reality is that I remind people that this is not a sprint. This is a marathon. It's a very long marathon. It's an ultra marathon, and we need to be prepared. We need to take care of ourselves, and we need to think about how do we adjust and how do we take care of our families and our friends. One of the things that I see for sure is that public health is maybe we getting a resurgence, and people all of a sudden are starting to understand how important is public health. So I think all of us also need to make a plea that public health funding does not go away and public health funding persists, because the reality is we need to be ready not only to get out of this pandemic but prevent the next one from happening.
I think you're absolutely right, Carlos. I think few things have underscored the importance of public health more than this pandemic. And few things I think have underscored the importance of good medical care as well, compared to this pandemic. And look, I think that going forward, there are a couple of last things I'd mention. One is that we now more than ever need trusted voices that have credibility to speak out on issues related to public health and medicine. If we leave it up to others in positions of power or people in government to be the sole educators of the public, that won't cut it, because we live in a world where there's so many sources of information and people are getting a lot of misinformation online, and there's a diminishing trust also in traditional sources of authority, which make the roles that all of you play as frontline workers all the more important when it comes to community education, because people trust their doctors and their nurses. They trust people who are dedicated to patient care more so than they do people in positions of authority. And the last thing I just want to say is a thank you. Thank you to all of you who are working so incredibly hard on the front lines, who are doing so at great risk at times to yourselves and your family, who are really in the middle of a great deal of uncertainty, but are continuing to show up each and every day to care for people, to put yourself sometimes in harm's way, because it's what you took a solemn oath to do, because it's what you've committed to as a profession. I also know that for so many of you, the work that you do day in and day out is more than just a job. You do it for more than just a paycheck. It's more than just a profession. It's a calling. It's a reflection of your deeper values. And I will say that one of the reasons I feel so proud to be a member of the family of medicine and a member of the sort of community of healthcare is because I have colleagues like all of you who are so dedicated to your patients, and who through your example each and every day, without seeking glory or the headlines, but simply by putting your heart and your head into your care of patients, you inspire me and remind me of why I chose to go into this profession so many years ago. So I know that there are hard times ahead. I know that there is a lot of uncertainty we're still dealing with. And I know that your families are also bearing the brunt of this alongside you. But I just want to thank you from the bottom of my heart for what you're doing. You are inspiring not only me, but so many people throughout the country with the great work you're doing.
Well, thank you, Vivek, and thank you for taking time from your busy schedule to be with us, and hope to talk to you soon.
Okay, I'll look forward to it. Take care, Carlos, and stay
Thanks,
safe, everyone.
thanks a lot.